Polyhydramnios is where there is too much amniotic fluid around the baby during pregnancy. That is, polyhydramnios refers to a situation where the amniotic fluid volume is more than expected for gestational age. Amniotic fluid is the fluid that surrounds your baby in the womb. Polyhydiamnios is generally defined as 1. Amniotic fluid index, greater than 25 cm. 2. Largest fluid pocket depth, maximal vertical pocket, greater than 8 cm. The amount of amniotic fluid is greatest at about 34 weeks gestation into the pregnancy when it averages 800 ml. About 600 ml of amniotic fluid surrounds the baby at full term, 40 weeks gestation. Too much amniotic fluid is normally spotted during a checkup in the later stages of pregnancy. The patient may clinically present as a large for dates uterus. Polyhydiamnios is not usually a sign of anything serious, but you'll probably have some extra checkups. You'll usually be advised to give birth in hospital. Will I have a healthy pregnancy and baby? Yes. Most women with polyhydramnios will not have any significant problems during their pregnancy and will have a healthy baby. But there is a slightly increased risk of pregnancy and birth complications, such as 1. Giving birth prematurely, before 37 weeks. 2. Your waters breaking early. 3. A problem with the position of the umbilical cord, prolapsed umbilical cord. 4. Heavy bleeding after your baby is born because your womb has stretched. 5. Your baby having a health condition. You'll need extra checkups to look for these problems. You'll usually be advised to give birth in hospital. Symptoms of polyhydramnios. Polyhydramnios tends to develop gradually and there may not be noticeable symptoms. Some women have symptoms like 1. Breathlessness. 2. Heartburn. 3. Constipation. 4. Swollen ankles and feet. These can be common problems for pregnant women and are not necessarily caused by polyhydramnios. Talk to your midwife if you have these symptoms and you're worried. In rare cases, fluid can build up around the baby quickly. Contact your midwife or doctor if your tummy gets bigger suddenly. Polyhydramnios occurs as a result of either increased production or decreased removal of amniotic fluid. The etiology of polyhydramnios can be due to a vast variety of maternal and fetal disorders. It is usually detected after 20 weeks, often third trimester. Causes of polyhydramnios. 1. Idiopathic. 60 to 65%. This is a diagnosis of exclusion despite accounting for a majority of cases, also termed idiopathic polyhydramnios. That is, it is often unclear why too much fluid sometimes builds up during pregnancy. 2. Maternal. 25 to 30%. Diabetes in the mother including diabetes caused by pregnancy, gestational diabetes, and maternal congestive heart failure. 3. Fetal. 10 to 20%. Central nervous system lesions, such as neural tube defects. Proximal gastrointestinal obstruction. Gastrointestinal atresia. Esophageal atresia. Duodenal atresia. Jejunoileal atresia. Abdominal wall defects. Gastroschisis. Omphalocele. Fetal intestinal volvulus, like from an intestinal malrotation. Fetal cervicothoracic abnormalities. Fetal cervical masses. Congenital cervical teratoma epignathus. Large fetal goiter. Thoracic masses. Congenital pulmonary airways malformation. Congenital high airways obstruction syndrome. Congenital diaphragmatic herniation. Fetal cardiovascular anomalies. Sustained fetal tachycardia, like supraventricular tachycardia, atrial flutter, ventricular tachycardia. 4. Twin pregnancy-related complications. Twin-twin transfusion. Occurs in the recipient. Hydrops fetalis. Immune and non-immune. Most babies whose mothers have polyhydramnios will be healthy. Polyhydramnios is associated with poor outcomes if present in combination with intrauterine growth restriction. Thanks for watching. May the mercy of God never depart from us all, amen. Please subscribe for more.